Understanding the importance of writing your daily log. This is the document that doctors would use, specialists would use, you would use to gauge what the patient's day looks like. And that is inclusive of from the time they get up in the morning until they go to bed, or if they are getting up through the night. It is a continuous logging of information, especially if you have 24/7 care. If you have short shifts, like an 8-hour shift or 10-hour, the caregiver comes in, they log. Now, really and truly, you are not supposed to log in that book. However, you can put your name in if it is that you know that you are picking up a shift and having to do the night shift and there are certain things happening. It's good that you can put the information in there in this case, so that the caregiver, when they come in the morning, they can have an appreciation of what the patient night looks like. Patient may not have slept at all, but this is good information to be writing down the daily vitals, what they ate, how much fluid they drank, their bowel movements, how much times they urinated, if there's exercises to be done, that their medication is being taken on time, the quality of their meals, if they, even down to they may have liked eating fish and now all of a sudden they don't want the fish at all. All these is, it's vital information that you need, and it's important to have it logged systematically, as in time. A lot of people, or a lot of caregivers, would do a paragraph, a summary. You have to read that entire thing and try to make sense out of what is written. It's better to have it timed. So at 8 o'clock, caregiver came on shift, patient was handed over by the other caregiver. You put down the name, information, etc. The caregivers know how they're supposed to write their log. But you need to also manage and monitor that it's being done properly. Don't assume that people are doing what they are supposed to do. You are the primary caregiver. You are responsible for caring for your parent, for your loved one. You need to ensure that the information is being recorded so that it makes sense. You have to make it make sense for everybody, because at the end of the day, this information is also used to put together their care plan, to put together whether you have the person improving certain maybe medication. Now that you have certain improvements happening, they may no longer require taking certain medications, and the doctors would take this information and make an educated decision, rather than just assuming or you thinking that you're going to remember at the next doctor visit to tell the doctor that, mommy's blood pressure has been real good for the last 2 weeks or the last month, and you don't have that information. What are you basing it on? You have to have the evidence. There may be times when, mommy's taking, when you give her the medication in the morning, she's very dizzy or very sleepy. The medications have side effects, and then if you have 2, 3, 4, 5, some people have a whole cocktail of 9 or 10 meds that they take 3, 4, 5 times for the day sometimes, in some cases. This is also information that needs to be logged. You cannot just rely on memory and that the caregiver is there and she know and she's always go to the doctor. We forget. You have to remember that you're caring for a loved one and your emotions are high, and it's a very stressful time for all parties. But make sure at the end of the day, log the information. If you do not live there with your loved one and the caregivers are there, you can form a WhatsApp group chat where at the end of a shift, a photo is taken of the log for the day and the night, and you can skim through it during the course of the day or when you have some sort of downtime, so that you're always staying in the know that you have other family members looking at it, because sometimes your eyes may read through something and say, oh, well, she had a good day, because you may be preoccupied with something. But really and truly, there are little things popping up that are red flags that you just looked over, and it happens. You don't have to be hard on yourself, but another family member may be able to pick that up and bring it to your attention or bring it to the doctor's attention. You may have a good relationship with your patients, your loved one's doctor, and you can just send them the log so that they can have a better idea and be up to date and be prompt on what needs to be done. So get into the practice of having a notebook, a copybook, whatever it is. It's nothing fancy, and you write it up. You write up the information in it. You have it systematically, 8 o'clock, 10 o'clock, 9 o'clock, whatever it is, throughout the day, different times when things are being done, so that you have consistency in the quality of the care plan that's in place for your loved one. Take care. Bye.